Hello, everyone. My name is Yuritza Escalante, and today I will be presenting on identifying at-risk groups for decreases in social connection caused by the COVID-19 pandemic. I worked on this project alongside graduate student researcher Eleanor Collier and faculty advisor Dr. Brent Hughes. So social connection plays a dominant role in determining an individual's sense of well-being, and as we have witnessed, the occurrence of the COVID-19 pandemic has dramatically shifted the social environment through the restrictions put in place. So far, research does not show an average decline in social connection during the pandemic. Therefore, this led us to wonder whether there are particular groups within the overall population that are particularly at risk of experiencing negative social consequences. Therefore, the potential risk factors that we will be looking into are participants' lower scoring on extroversion, high scoring on anxiety, higher scoring on social anxiety, and high scoring on depression. Looking into these factors will help us explore the question, what groups are particularly at risk for suffering negative social consequences caused by the COVID-19 pandemic? In our study, we recruited 90 participants before the pandemic and 120 during the pandemic. The participants had a median age of 19 years old, and with the majority of them coming from an Asian and Hispanic ethnic background. In the study, participants were told to complete an initial set of questionnaires in which they were asked about their overall well-being and traits about themselves. This is where we got some of the measurements that we will be looking into in this presentation. Such as extroversion, anxiety, social anxiety, and depression. Participants were then told to complete 10 daily diary surveys in which they would report on meaningful interactions that they experienced throughout their day. In this survey, an item asking how connected did you feel with your conversation partner on a scale of 0 to 100 was included in order to measure for social connection. So once the data was collected, we first examined to see if there was an overall trend in social connection before the pandemic and during the pandemic, and no such trend appeared. So this aligns with previous research findings. However, we did find that marginal differences did appear when examining particular groups within the study. The way that we did this is by examining the interaction between cohort and potential at-risk groups on social connections. So in order to visualize our results, we will be looking into the social connection scores of participants before the pandemic and during the pandemic in reference to the at-risk factors. Therefore, when looking into participants' low scoring on extroversion, high scoring on anxiety, and high scoring on social anxiety, we see the same pattern appear that these participants experience a decrease in social connection during the pandemic compared to before the pandemic. These are all marginal effects. However, the social anxiety group did show the strongest effect. And when looking into participants' higher scoring on depression, we found that no such pattern appeared in changes with social connection during the pandemic before the pandemic compared to during the pandemic. Therefore, some reasons for these results may be that different participants were tested before the pandemic and during the pandemic, as opposed to the same participants being tested across time. Also, data collection occurred early on in the course of the pandemic. Therefore, negative social consequences may have become strengthened further down along the pandemic. But although only marginal effects were found, they were all for the predicted direction, which was that these groups would experience a decrease in social connection during the pandemic compared to before the pandemic. And this direction was found this effect was found in individuals higher scoring in anxiety, high scoring in social anxiety, and lower scoring on extroversion, but it was not seen in participants higher scoring on depression. Therefore, this shows that these factors may worsen the negative effect of the pandemic on people's social connection, and it indicates that we may need to focus on intervening to improve connection for these at-risk groups during socially isolated periods of time. Lastly, I would like to thank my graduate student mentor, Eleanor Collier, and faculty advisor, Dr. Brent Hughes, for their support and guidance throughout this project. I would also like to thank everyone for listening to my presentation. I am happy to answer any questions that anyone has.